Hey everyone, welcome back to VetFolio Voice. Today's episode is sponsored by VetScience and features Dr. Laura Gaylord here to talk about what we can do to help support liver health in our patients. Of course, the liver is hugely important to the overall health and well-being of our patients. It serves so many functions and can be affected by many different processes throughout the body, as well as influenced by outside factors such as medications. Because of this, it's imperative that we support liver health to help ensure our patients' continued overall health. Here to talk to us about just that is Dr. Laura Gaylord. Dr. Gaylord is a board-certified veterinary nutritionist and one of only 100 diplomates in the American College of Veterinary Internal Medicine subspecialty nutrition. She's an independent consultant and the owner and founder of Whole Pet Provisions PLLC, a nutrition consulting company established in 2016, which offers a variety of veterinary nutrition consulting to pet owners, the pet food industry, and pet supplement companies. She's been a general practitioner in North Carolina for over 24 years, working in integrative and physical rehabilitation practices. She offers homemade diet recipe formulations and commercial diet consultations through her business for pet parents and their veterinary team. Combining her years of clinical experience with her passion for nutrition, Dr. Gaylord seeks to promote optimal wellness and integrative veterinary care for companion animals and the pet vested industry. Well, I am joined today by Dr. Laura Gaylord, and we're going to talk a little bit more about supplements, and in particular, supplements to support liver health, something that's hugely important. So, Dr. Gaylord, thank you so much for joining me.
Thank you so much for having me here today. I'm so excited to talk to you about liver health, a topic that is one of my true interests in practice as well.
Well, I'm so happy you're here because I have so many questions about it, and I can't wait to hear your input.
Wonderful, wonderful. We can dig in.
Yes, yes. So this is something that we've mentioned before on the podcast, but something I feel like we would be remiss if we didn't just review here in the beginning. And that's, how do you choose a supplement?
That is an excellent question. I know many practitioners, today we're actually overwhelmed because there's so many choices out there. So it's really helpful to have some kind of thoughtfulness about choosing supplements. And I will first maybe start, of course, you're going to choose a supplement that is targeting maybe the disease condition or the body system you're trying to influence. But then you want to look at a product, consider what company makes that product. So what you know about that company, maybe its track record, who's involved in the formulation of those products, basically your familiarity with that company. And you can basically then look towards the product itself. So then what ingredients are in that product? How many ingredients, what is the dosage of those ingredients, always mindful of, particularly interactions and so forth. But then I will go beyond that. And I do look for some type of third-party review of that product and the company. So that may mean an independent lab has taken a look at that, or an independent organization. And one we look to greatly and very often is one called the National Animal Supplement Council, or what we abbreviate that NASC. So that is the only group right now that is offering basically reviews and being sort of a watchdog on the supplement industry for veterinarians or animal products. And so I definitely look for that. I look for that NAS seal that can be on the product or on the website, and that will influence my decision on what products to choose.
Talking a little bit more about the NASC, that's one of those things where I feel like I know to look for this. I know that this is who's evaluating, the third party who's evaluating a lot of these supplements. But can you talk about their role in a little bit more detail when it comes to evaluating dietary supplements for our patients?
Absolutely, absolutely. So NASC is an organization that is focused on quality, and they've made efforts to put together some guidelines for that. So they have it in a written form. They basically follow behind companies. They look at raw ingredient sourcing, manufacturing standards. They actually have a mechanism in place to report adverse events and track those. And they also look at labeling and claims that are being made to make sure that they're appropriate and they're within the guidelines for supplements. So that seal means something. The companies working towards that seal have put in a lot of effort in order to get there. And so definitely that will help us choose quality supplements that are being manufactured and made appropriately for our patients.
Absolutely. Because, like you said, there are so many options out there that it helps us narrow down and really focus on quality in that regard.
Absolutely.
Well, let's talk a little bit more specifically about liver supplements. Why is it important to support liver health?
Well, I think, we obviously all know about the liver, right? It's there, it's doing a lot of things. But I
I
think
think that's where we get lost is like, well, it
right.
does so many
It
things.
does
What are we
so
supporting?
many things. Absolutely. It does so many things, and it can be overwhelming, and it's kind of in that, that zone where it's involved in everything going on in the body. One of the key takeaways from me going through my nutrition concentration, it was a great reminder. Like, we focus on internal medicine as well as nutrition when we are training. And we basically revisit all those biochemical pathways the liver's involved in, all the roles it plays in digestion, absorption, breakdown of nutrients coming into the body. But it also is super important in detoxification. So hear that word detox, right? And it's kind of funny. We laugh maybe a little bit, but it's so important. And I think we're recognizing more and more that yes, detoxification is super important in our bodies as well as our pets. And so the liver has a big job in that. It breaks down nutrients, molecules that are coming in from the GI tract, and even more importantly, drugs. So if we have pets on medications that are, chronic, this is a zone where, we can think about liver function and how it works there. So definitely the liver has a role in so many different things. It's so important for health.
I have to know more about this detoxification that we're talking about. Like you said, it's something, we hear about a lot. It's become this buzzword that is used in a lot of different contexts. So, can you talk a little bit more specifically about detoxification? What do you mean by detoxification?
Well, yes. So I'm going to draw from all what we all learned right back in veterinary school, way back when we learned about, the enzyme systems within the liver itself. We think of that cytochrome P450 family of enzymes that are involved there. And then detoxification is basically broken down into different phases. So the first phase one, we call it, is where the liver is working to convert molecules into a form that can be better eliminated from the body. So that's fat soluble molecules maybe being converted into water soluble molecules. And then the second phase, or phase two, is where there's conjugation reactions. So the liver is basically adding things or changing things, making them again more likely to be eliminated and taken out of the body. And there's actually a phase three where we're working through transporters. So transporters are picking up different metabolites or even drugs, and then again eliminating them from the body in various ways. So basically those phases are taking things that the body's job, is to get rid of. The liver's job specifically is to break down, convert to a form that we can eliminate it from the body and keep us healthy.
I love it. So there is I think that was a great scientific explanation for this detoxification process because, kind of like we said, it's used so often as a buzzword and it's kind of like, what does that mean? Is that even real? And so thank you
Right.
for breaking that down in a way that, our scientific minds can kind of wrap our heads around and understand.
Yes. Yeah. You'll see, I'm doing a detox, different
Right.
programs that are out there, and it's kind of silly, but actually it's true. We do have to detox our bodies, and we're exposed to things all the time. So that is a big job the liver performs for us, and it's super important for us to keep the liver healthy for that reason.
So if I'm hearing you correctly, then it sounds like, kind of like you said, I'm doing a detox type of thing, but it sounds like our body is doing the detoxification itself. Our job is to support organs like our liver who are responsible for doing that detoxification process.
Absolutely. So, we want to set ourselves up and set our patients up in the best possible place that they have everything they need. The liver has all of the nutrients and maybe molecules accessible to it so that it can perform those normal functions. And that's where supplements and nutrition can be super important for liver health, that we can actually influence that and support that. It may be that that pet comes in and is going through a disease condition, and we want to make sure the liver's in the best shape it can to do its jobs. Or it could be that we're having to use other medications or drugs to treat another disease, and we know that the liver is going to play a role in detoxifying, eliminating, and supporting that pet through that. So these are all spaces where liver supplements can really help us out.
I feel like the clouds just like cleared in my brain. I'm like, oh, that makes sense. I get it. Exactly what you're talking about.
Yeah.
Let's talk a little bit more about when to start a liver supplement, because you've talked a couple of times about different comorbidities, disease processes, different medications a patient might be on. Is there any data as far as when to start a liver supplement? And the other thing I'm thinking about more specifically are these older dogs who have elevated liver values, mild to moderate, with no real definitive diagnosis. They're not changing a whole lot year to year. Is there a certain time when we should start that liver supplement? Is it as soon as we see the elevations? What are your thoughts on that?
Yeah, that's a really great question. And I think in practice, I was in practice for numerous years as well. And I would have these pets come in where maybe we're initially picking up some elevations of liver enzymes, and perhaps we don't have a diagnosis for that. It may be that clinically they're doing really well. So they feel well, they're eating well, they're still doing other things well, but we're like, what is that? What is you have a question mark at what is the cause of that? So that is one area I will start to think about, maybe a liver supplement might be appropriate. Basically, if I feel like they're stable and perhaps, the liver enzyme elevations are not severe and the clinical signs are not severe, and talking with the owner, we're looking at doing more testing or advanced diagnostics, but maybe they're resistant or they're reluctant because sometimes those diagnostics are expensive or perhaps invasive even. And it's appropriate for us to have a phase where we're monitoring that pet, initially perhaps. So that's definitely when I'm thinking of a liver supplement can be a really good addition to that pet's treatment plan. Even if we are going forward and we're going to do some of those diagnostics and testing, trying to work towards a diagnosis, I'm still proactively probably going to put them on some type of supplementation because I feel like that is going to be helpful, never harmful, to provide those building blocks, nutrients that liver needs to work well. So as long as they tolerate those supplements okay and it makes sense, that is a zone where many pets, we could be thinking about adding a liver supplement there. Other situations where I might be thinking of liver supplementation products, definitely pets that are on chronic medications for other diseases. So when we are thinking about different drugs, anticonvulsants we're using for epilepsy, or non-steroidal medications we're using for arthritis, those are probably the top two scenarios where I'm thinking about supporting that liver, because I know that those drugs will be broken down through liver metabolism. So we want to support that process and keep them as healthy as possible. And so that's another category I definitely think about adding a liver supplement.
So, like you said, just really supporting that liver to be able to do its job, whether it's because we have these drugs on board or we don't actually know why these liver values are elevated. Just giving the liver that good support. You've mentioned the drugs a couple of times, dogs on medications. Can you talk a little bit more about the role of the liver and then also liver support when it comes to animals who are on different medications?
Well, we know that those drugs going in are going to do their job, but then they're going to have to be broken down and eliminated from the body. So that goes back to that detoxification, function that the liver has. And so when we put those in, if the liver is not supported well enough, or if we have any compromise to liver function, there's some risk that that drug could accumulate over time, and we're going to have an increased risk of side effects. And we definitely want to avoid that. So if we can put in a supplement that's going to help support liver function, detoxification, elimination of that drug, then that's going to keep us in the best possible shape so we can continue to treat the disease that we're doing with those drugs and medications optimally.
I love that. Just supporting the liver, not necessarily saying, oh, we're doing this to help prevent side effects, although of course we are.
It's important to remember that supplements are not drugs. We give supplements because we want to support normal, healthy states. So we don't use them quite like drugs. We use them to support wellness. So that's why we're using supplements in combination with other disease conditions, but also with other medications, just to support the normal processes that should be going on with each pet.
And not so much as waiting until there's a problem to do this, but doing it in conjunction with these medications to help prevent the accumulation of side effects.
Absolutely. So I am always proactive in how I prescribe treatment plans for my patients. And as a nutritionist, I look at it more as, preventative nutrition always. We're trying to influence and modify disease conditions with nutrients. And I consider supplements nutrients for different organ systems. So if I know that I'm going to be proactive in supplying nutrients to set that organ system up for its best health, or it's make it able to do its job best, then I think that is definitely a good thing to do. Thinking proactively about what we're doing, what medications or drugs we're putting in that pet, and which organ systems are going to be involved in metabolizing and eliminating those. We can definitely then look towards which supplements might help us, keep them as healthy as possible.
It's kind of like our mothers told us growing up, an ounce of prevention is worth a pound of cure.
100%, definitely.
So, what are some of the considerations that we should keep in mind when we're trying to choose the correct liver supplement for our patient?
Well, you have a lot of options there as well. And we know that because the liver has different jobs, primarily in this detoxification zone, there's different angles that we can approach trying to support that. And so typically what we're looking for is nutrients that are going to aid in its antioxidant function or its detoxification function. So we know antioxidants are going to be beneficial there. We know that different flavonoids coming in from diet or supplements in a more concentrated form are going to be beneficial. There are other nutrients that are well studied in human as well as veterinary literature, including SAMe. Basically, SAMe provides that precursor for glutathione, which is super important in these detoxification reactions. There's other nutrients, basically a diverse array of nutrients that are all considered antioxidants. And typically, my approach to this is I want to have more than one, thinking that I'm hitting it at all different angles. So rather than relying on one single or very few nutrients to do what I'm trying to achieve, I might look at a product that has more than one thing for that regard because it's going to approach it at multiple different levels.
Kind of like we think about, say, a probiotic or something like that, using multiple different strains to get that variety and get the benefit of everything.
Absolutely. We know in the probiotic world that one single organism may or may not achieve what we're trying to do. But if we have a multi-species product, we're going to hopefully provide an array of different types of bacteria. Well, in this regard, for a liver supplement, we have lots of different detoxification reactions, probably many we don't even understand yet. And so if we provide different antioxidants, our chance of having some of those exert a beneficial effect is going to be greater.
Dr. Gaylord, I am very glad you're here because you're taking my nonsense that I feel like is coming out of my brain and making it into a much more concise and easy to understand explanation.
Awesome. Awesome. That is wonderful.
Are there any precautions that we should keep in mind when we're selecting a liver supplement, side effects we need to be aware of, or, conditions where maybe we shouldn't reach for a liver supplement?
Well, to start that off, I would say that I am so comfortable with liver supplements because I feel like they are so safe in general, and it's so very rare for me to have any problems with liver supplements. I think that in the spectrum of supplementation, they're very, very safe. But I think probably with anything that goes in the pet's mouth, there's always going to be a chance you're going to have that one sensitive little white poodle dog, right? that
Always.
Might get a little bit of stomach upset or something from any type of supplement. And that's true for liver supplements as well. So different products are available. Some of them might suggest giving with food or without food. I think it's important to follow the guidelines of the manufacturer there and try to, use it in the way that is recommended. But that's probably the most common issue is maybe mild GI upset And this is why with any supplement, really, I follow the rule that I might add one thing at a time, give it a couple of days to see how that goes. We're only changing one thing in that pet's treatment plan during that time. So we know, what product or what intervention caused an adverse reaction. But in general, again, I would say that by far, I feel very comfortable with liver supplements because I feel like they are very well tolerated.
Excellent news, because it sounds like there's a wide array of situations where they could be applied. So good to know that in general, they're pretty safe and well tolerated.
Yes, I would agree with that.
Any other dogs that you want to make sure we're thinking of when it comes to liver supplementation?
Yes, so definitely we're going to have that group of dogs that have had diagnostic testing done as well. And we perhaps have confirmation that we do have some types of liver diseases present. So that could be our chronic hepatitis dogs, even dogs that have copper storage disease, or maybe they're a breed that is also predisposed to develop liver disease over time. I'm thinking of the Scottish Terriers that we have liver enzyme elevations. These are all dogs that are potential candidates for liver supplements and ones that I would be thinking of adding a carefully selected supplement in their treatment plan to make sure we're giving them the best chance to have, liver regeneration and repair. Perhaps we can even slow the process down or reduce chronic changes present in that liver. So scarring, fibrosis, things we see on biopsy. Our hope would be to maybe minimize that as much as possible by putting them on a supplement.
Well, wonderful. Well, Dr. Gaylord, this has been fantastic, very informative, and I so appreciate you coming on and talking to me about all of this. Are there any final thoughts you want to share with us?
Oh gosh, I would just encourage you all to think proactively about using liver supplements because I do feel like they're underutilized. So there are many situations where we might be practicing what we call benign neglect for monitoring those liver enzymes. But we don't have to do nothing. There is something we can do that can help our patients. And choosing a well thought out supplement that's put together that has numerous beneficial ingredients included from a company that you trust that hopefully has the NASC seal, all of those things can come together and we can definitely help a lot of pets if we do that.
Awesome. Awesome. Well, thank you again.
Thank you. Thank you so much for having me here today. It's very nice to speak with you.
You as well. Dr. Gaylord, thank you so much for joining me to talk about liver health and what we can do to help support health and wellness throughout our patients' lifetimes. I also want to say a huge thank you to VetRescience for making this episode possible, and of course to all of you for joining us. To learn more about VetRescience products, visit their website at vetraproline.com. That's VETRIPROLINE.com. To find more episodes like this, click on the Education tab on the VetFolio website. As always, we'd love to hear your input on this episode as well as ideas for topics you'd like to hear from us in the future. Feel free to reach out to me at dvm@vetfolio.com. You can also visit my Facebook page at Dr. Cassie DVM, and you can find me on LinkedIn. And remember, if one animal is better off because of you today, it's a great day.